Dear students, welcome to our channel. Today we will be learning about relative risk and odds ratio. In this lesson, we will be learning about what is risk, what is odds, what is relative risk or risk ratio, and what is odds ratio. These are the learning outcomes. At the end of the session, students would be able to define and describe the terms risk, odds, risk ratio or relative risk, and odds ratio. Why to learn about risk ratio and odds ratio? This is the era of evidence-based medicine. So before taking a clinical decision, before making a clinical decision, doctors need to read the latest research articles on the topic. For making clinical decisions about the treatment or intervention, doctors need to read the latest randomized controlled trials and the latest systematic reviews on the research topic. In the latest research articles, there will be terms like odds ratio and relative risk. Okay, this picture is from a systematic review showing the relative risk of uh, getting an outcome from various research articles. Okay, and by seeing the relative risk value, doctors should be able to decide if the treatment is effective or not effective. Another picture showing the odds ratio of deaths among corticosteroid users and placebo users. Okay, which is better? Okay, in this research, it is shown that odds ratio is lower among corticosteroid users. Odds ratio of getting death is lower among corticosteroid users compared to placebo users. So, if doctor is not aware of the terms risk ratio and odds ratio, he will not be able to make good decisions based on the latest research evidence. So, these are the two aims of learning what is risk ratio and what is odds ratio. First, it helps to assess the strength of association between the risk factor and outcome. And second one is it helps to apply the latest evidence in evidence-based medicine. Okay, for learning about risk and odds, we can go through the example. We are comparing two groups. One group of individuals consumes caffeine drinks and another group of individuals consumes decaffeinated drinks. Among caffeine drinkers, out of 68, 17 people got headache, while 51 individuals didn't get headache. Among decaffeinated drink users, out of total of 64, 9 individuals got headache, while 55 didn't get headache. Out of total 132, 26 individuals got headache, while 106 didn't get headache. So, first we will learn what is the risk of headache among caffeine users. What is the risk of headache among decaffeinated drink users? Okay. Risk is number of participants with event of interest divided by total number of participants. In this case, risk of headache among caffeine users will be total number of caffeine users who got headache divided by total number of caffeine users. In this case, total number of caffeine users who got headache is 17. Total number of caffeine users is 68. So in this case, risk will be 68 people consumed caffeine, out of them 17 developed headache. Risk of headache among caffeine users is 17 divided by 68. So that is 25%. Okay, 25% is the risk of headache among caffeine users. Okay, can you find out what is the risk of headache among decaffeinated drink users? Total number of decaffeinated drink users are 64. Out of them, 9 got headache, right? So risk of headache among decaffeinated drink users will be total number of those with headache among decaffeinated drink users. That means 9 divided by total number of decaffeinated drink users. That is 64. 9 divided by 64 will be the risk of headache among decaffeinated drink users. Now we can go through odds or likelihood. What is the odds of headache among caffeine drinkers? So odds definition is number of participants with event of interest divided by number of participants without event of interest. Odds of headache among caffeine users will be those who got headache among caffeine users divided by those who didn't get headache among caffeine users. So in this case, 17 got headache among caffeine users, 51 didn't get headache among caffeine users. So 68 people consumed caffeine, 17 developed headache. So odds of headache among caffeine users will be 17 got headache divided by 51 didn't get headache. So 17 divided by 51 will be 1 out of 3. That is 0.33. That is the odds of headache among caffeine users is 0.33. What is the odds of headache among decaffeinated drink users? You look at that. Among decaffeinated drink users, 9 got headache, 55 didn't get headache. So odds of headache among decaffeinated drink users will be 9 divided by 55. Okay, got it? Now we can go to next slide. How to express risk in words? Okay, the risk of having headache was 1 in 4 or 25%. Okay. Odds. How to express it in words? The odds of having headache were 1/3 of the odds of not having headache. One person had a headache for every 3 people who didn't have headache. So odds of having headache were 1/3 of the odds of not having headache. Relative risk or risk ratio is the direct measure or index of the strength of association between suspected cause and effect. Okay, risk of event with intervention. That means risk of headache among caffeine users. That is risk of event. Event here is harmful event. That is headache. Risk of headache with intervention. That is caffeine use. That is 17 out of 68. risk of event with control. Then here control or comparison is decaffeinated drink. Risk of event means risk of headache among decaffeinated drink users. That is 9 out of 64. So risk of event with caffeine use is 17 out of 68. Risk of event with control is 9 out of 64. Risk ratio or relative risk is equal to intervention risk divided by control risk, or risk among intervention group divided by risk among control group. Here 17 out of 68 is the risk among intervention group divided by 9 out of 64 is the risk among control group. So 0.25 divided by 0.14, that is 1.79. That is the risk ratio or relative risk. Where risk ratio is 1, there is no difference between the intervention and control group. In this case, if risk ratio or relative risk was 1, means risk of headache among caffeine drinkers will be equal to risk of headache among comparison group or decaffeinated drinkers. Here, risk ratio is 1.79. That means the risk of headache among caffeine group was higher than risk of headache among decaffeinated drink users. Here, relative risk of 1 indicates that there is no association. A relative risk greater than 1. That means positive association between exposure and disease under study. A relative risk of 1.79 indicates that the incidence rate of disease is 1.79 times higher in the exposed group as compared to the unexposed group. Or incidence rate of headache is 1.79 times higher in the caffeine drinker group as compared to decaffeinated drink users group. In other terms, we can say that 79% higher in exposed group than non-exposed group. Okay, got it? Now we can see how to calculate odds ratio. Odds ratio means we will calculate odds of event with intervention group. That means odds of headache among caffeine drinkers group. Odds of headache among caffeine drinkers use means caffeine drinkers group means 17 got headache out of caffeine drinkers. 51 didn't get headache. So odds of headache among caffeine users will be 17 out of 51. Odds of event among control group, that means odds of getting headache among comparison group, that is decaffeinated drink users, will be 9 got headache, 55 didn't get headache. So 9 out of 55. Odds ratio will be odds of headache among intervention group or caffeine drinkers group divided by odds of headache among control group or decaffeinated drink group. So here 17 out of 51 divided by 9 out of 55. So 0.33 divided by 0.16, that is 2.06. Okay, here odds ratio is 2.06. When odds ratio is 1 means there is no difference between the group. Odds of headache among intervention group will be exactly equal to odds of event among control group. That is why odds ratio is equal to 1. Okay. Odds ratio 2.06 means intervention double the odds of headache. That means odds of headache was double, more than double in the caffeine drinkers group compared to decaffeinated drink users group. Intervention increased the odds to 206% of the odds in the control group. So in other terms, we can say that intervention, that is caffeine drinking, increased the odds of headache by 106% compared to decaffeinated drink usage. Okay, is it clear? Now we can conclude. Risk refers to the probability of an adverse health outcome occurring within a group of individuals. Okay. Odds represents the ratio of likelihood of outcome happening to the outcome not happening. So the odds means how many people got the health outcome divided by how many people didn't get health outcome. Risk ratio is otherwise known as relative risk, quantifies the probability of an event occurring in an exposed group as compared to an unexposed group. Outcome among the exposed group divided by risk of outcome among the non-exposed group. That is the risk ratio or relative risk. Odds ratio estimates the odds of event occurring in the exposed group as compared to the odds of event occurring in the unexposed group. Hope you understood the terms risk, odds, risk ratio, and odds ratio. Thank you so much.